Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us.
Today I'd like to welcome back our guest, who's one of the LDN Research Trust's medical advisors, Dr. Leonard Weinstock. Thank you for joining us today, Lenny.
Oh, thank you so much, Linda.
So could you explain, as a doctor, how frustrating it is for you to try and diagnose a patient that's got multiple complex conditions?
It's frustrating until you know the answers, until you're aware of the conditions that can produce 42 symptoms in an individual. I've taken care of patients for 35 years who have stuck with me just because I listen, I try new things and so forth. But it wasn't until 2016 did my brain explode with syndromes that now I had answers to. I had answers to somebody who came in with 42 symptoms. It was dramatic that when I met somebody named Jill, who came to me who was partially treated, and just by tweaking the LDN dose and giving her SIBO therapy, antibiotics for bacterial overgrowth, did all of her 42 symptoms of 9 out of 10 severity, 10 out of 10 severity go down to 0. And these were symptoms in every single part of her body. And this is somewhere where doctors are totally stymied because they know about their specialty. They know all the basic things of high blood pressure or allergies, maybe with hives, or gastroenterologists with irritable bowel and nausea, but they don't know about mast cell activation syndrome. They don't know about postural orthostatic tachycardia syndrome, and they don't really know about Ehlers-Danlos syndrome.
Okay.
So these syndromes make up to 17% of the population, to one degree of severity to another. They're going to come to the doctor, like the gastroenterologist, with irritable bowel symptoms, with chronic nausea, chronic bloating. That's defied every treatment that one can give and one would be aware of. But when you know about the syndromes, you know to start thinking outside the box and asking the question, could this individual have MCAS, mast cell activation syndrome? Could this patient be passing out and having many other symptoms because they have postural orthostatic tachycardia syndrome? Could they have chronic constipation, severe upper abdominal pain, refractory small intestinal bacterial overgrowth because they have Ehlers-Danlos syndrome? And the answer to all those questions are absolutely. And when you know about the syndromes, then you know how to treat the patients, and you're smarter and you're better doctor, and you're better to take care of them without being frustrated, because now with the diagnosis, you have treatment and you have hope.
Okay. So for a patient that has been having these symptoms for years and hasn't found the answer, how do they find a doctor like yourself?
Well, the internet. My latest patient that I presented at the LDN conference in Pennsylvania was a woman, 31 years of age, who's been suffering all of her life with Tourette syndrome and many inflammatory and allergic symptoms, severe nausea, severe fatigue, severe muscle aching, nerve pain, and so forth. And what she did, she asked Dr. Google. She typed in all of her symptoms and clicked enter, and it came up with mast cell activation syndrome. And because she was typing it from Columbia, Missouri, 2 hours away, she found my name. She came in. She told me about all the systemic symptoms. And after 45 minutes, I said, okay, well, I think I know what to do. We're going to get some urine and blood tests to prove it. And then she said, well, Dr. Weinstock, I also have Tourette's syndrome. Well, I was not familiar with Tourette's as being one of the mast cell symptoms, but my mind was open. And the more I dug into it, I found out that there were inflammatory changes in the brain that can cause Tourette's syndrome. And so with low dose naltrexone, she had a dramatic improvement. And this is in the proceedings of the last conference, which you can buy online. And there's a lot of great lectures this year. I'm going to tell you that it was a great conference. So many things about different ways to dose naltrexone. It was really mind-blowing. But with respect to Molly, she had all these symptoms. She had actually tried antihistamines because that's the first two things that you can do, famotidine and loratadine, for instance, generic H1H2 blockers. And she didn't get relief. So I did what I always do with my inflammatory patients, my autoimmune patients, my patients who everybody has tried everything on. I put them on LDN. And she had a dramatic improvement. She had no fatigue with exercise. She was more clear-headed, and she had lessening of her Tourette's. So her MCAS symptoms got better with LDN. There's no doubt about it.
What other tools do you use to treat MCAS other than LDN?
Right. So the mast cell has 200 receptors. Half of them are activating, half are deactivating. You can't just use one drug. You have to use multiple drugs at this point. But the basic step one, which is in an article that I wrote called Primer for MCAS, Primer for Gastroenterologists, and that's readily available. And unfortunately, I didn't include my work on LDN in that site, but I did put it into the LDN book 2 that you graciously edited. But here it is, step 1, antihistamines, famotidine, one of the non-sedating H1 blockers, such as loratadine or Allegra. The next one is vitamin C and D. You want to get the vitamin D levels so it's anti-inflammatory, high enough in the upper normal range. And then a flavonoid, either quercetin or leodolin. And finally, the only prescription medication, low-dose naltrexone. That's step 1. Plus, you want to do a 3-week trial on gluten-free, dairy product-free, and low histamine diet. And then after that, you assess things and you reassess things and say, okay, I'm going to go up to step 2, cromolyn, montelukast, or a compounded medicine that the compounding pharmacies are well aware of, ketotifen, which is a special H1 blocker. And then there's step 3 and step 4 as alternative therapies, and that's reviewed in part in my article, along with Dr. Afrin, mast cell activation syndrome, a primer for gastroenterologists.
Mm-hmm. But you didn't really answer my question. You said about the Google and this lady found you, but are there many doctors like yourself who understand this protocol?
It's getting more and more. I will tell you that the integrative doctors have embraced it. The functional medicine doctors have embraced it. The naturopathic doctors are also on board. They just can't prescribe medication except in 3 states, let's see, Oregon, California, and Washington. So, but they give a lot of herbals and supplements, which also work. So there's natural treatments, NAD, NAC, ALA, CBD, THC. I'm firing these out. But if you go to gidoctor.net and go to specialized services and go on to mast cell activation syndrome, there's a questionnaire to tell us and tell your doctor, I think I have mast cell. In fact, I have a high score of mast cell symptoms. And here, doctor, are the things that can help. And there's a list, that's a 14-page document that I've drawn up that can help treat yourself or be treated by your doctor. And I will tell you, Linda, that the majority of the treatments for mast cell activation syndrome and POTS and even EDS are either over the counter or via LDN, which could be found by the prescribers we have on the LDNresearchtrust.org, an amazing, amazing website. Thank you. And you could find, if you don't see a doctor in your vicinity, there are doctors that do this online. And there are doctors who have a multi-state license. And these doctors who are signed up for LDN know about MCAS. And they know about, even if they don't know everything about MCAS, they are willing to prescribe LDN for inflammatory and allergic conditions.
And how long would you say it would take for a patient to start noticing improvements?
4 days to 20 days. You need to juggle things around and tweak things. There are things called excipients, which are chemicals, packaging material, preservatives, and food dye in our pills. And the mast cell patients are often allergic to some of those. So if you start a medicine, let's say you start Allegra, which is a trade name, and it's got a food coloring that you react to, then you'll get worse with it. Not that it happens often, but sometimes that does happen. And that's where people who already have 10 allergies, they don't have allergies to drugs. They have most likely allergies to the excipients. So you might have methylcellulose. You might be allergic to pine trees. I'm surrounded now on my vacation by pine trees. If you're allergic to the sap and the pollen from pine trees, you're going to be allergic to methylcellulose. You're going to need to tell your pharmacist about that and get your LDN or your ketotifen or even your famotidine and loratadine mix up in rice flour, or as Jay from Compounding Pharmacies in Virginia, he uses a prebiotic compound.
Mm-hmm. Okay, so would you like to tell our listeners about the documentary that we're trying to get off the ground?
Right. So a little history. 3 years ago, I came up, we were at a conference, an MCAS conference. I said, you know, medical schools are not going to just suddenly, pick this up. It takes so long to change the curriculum. And how are we going to get this syndrome and POTS and EDS into the knowledge base of the public, into the knowledge base of medical providers? And so I said, what about a documentary? So we sat down at the meeting and said, okay, let's do it. Let's get a 501. Let's get fundraising going. Let's investigate how much it costs. Well, bang, COVID happened. Bang. It was $1 million for a good quality documentary. And so I found you at the conference and told you about our woes and problems. And you said, LDN Research Trust has produced 6 documentaries. I'll be your 501. I'll teach you about fundraising. And graciously, you've done so. You've hooked us up with your documentary filmmaker who's done 6 other wonderful documentaries for LDN Research Trust. And we're off to the races, but we need funding. But we're also going to make this documentary not just about 4 patients and 5 doctors who treat these different conditions. It's going to have links to educational lectures that will allow a medical student who's interested in this, possibly because their sister has MCAS, 17% of the population. They're going to be able to go to YouTube channel and for MCAS POTS and EDS documentary and click on to educational PowerPoints with voiceovers. So to make this happen, we need to raise money, and it's a nonprofit. It's going to help a lot of people. It's going to help the medical community. So go to mcasfund.com. That's mcasfund.com. And if you've got $20, please donate. It's going to be really important. And I know there are a lot of other causes to donate to, but if you're watching, you already know something about LDN. But did you know LDN helped these 3 syndromes: reduce pain, reduce inflammation, reduce mast cell activation? And it's so prevalent. And if you just think about your family members or friends, there's a 17% chance that they have gastrointestinal symptoms, brain symptoms, migraines, brain fog. They have fibromyalgia. They have restless leg syndrome. They have ringing of the ears. These are very highly prevalent symptoms and syndromes that are caused by one thing: an abnormal mast cell that can be controlled if you can recognize it.
Thank you very much for having joined us today and educating us on difficult to treat conditions.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.